Okay, I'm gonna begin the didactic head to toe assessment. And this is my husband Burton, and let me grab my stethoscope.
Your cat.
My cat. Okay. First, I'm going to begin with the skin. The skin has pink undertones. And there are a few little scattered tiny macules to the lateral side of the face. Let me see one. In the arms, the skin's warm, dry, skin turgor. It's good, well hydrated. And on the feet as well. And there is a small scratch on the right forearm, which I'm assuming is our cat. And there's a few spotted macules to each arm. And the lateral aspects of the arm, I believe from sun exposure and age. He also has a bruise of a purple color to the right antecubital area. And the hair on the head is thick and brown in color, soft, but a little coarse just by visualizing it. To touch, though, it's soft. The eyebrows are symmetrical, and they go upward and outward to the top of the ear. The eyelashes are thick and soft, and distribution's equal. He does have a small scar to the top aspect of the lip and in his left eyebrow line, and there's also a small one to the left cheekbone, top of the cheek, face. And he has a little stubs from hair distribution on the face. The scalp is freely movable. There's no lesions. Okay. And we look at the eyes, the lacrimal duct, no pain, tenderness. And then the sinus area. And that hurts. Okay. And then looking at the eyes. Could you open your eyes? Okay. And I do have an ophthalmoscope, but however, as I said in the video before, we're in Finland and I can't plug it in, so I can't actually look into the eye. But I will use a flashlight. And the eyes are a light blue to green color. And the pupils are equal, round, reactive to light. Alright, and watch. Okay, and they do accommodate. And then the tests we'll do are for the optic nerve number 2, or cranial nerve optic number 2, and the Snellen test would have been done, and that would test for distant vision, and the Rosenbaum would have been done, and that tests for near vision. And then I'll get you to look at the object out here and cover one eye. And now look to your left. Now uncover your eye. Okay. And look straight. Okay. And they track equally, the eyes do. And then we're going to test extraocular eye function, which is cranial nerve numbers 3, 4, and 6, which are the trochlear and abducens. It's 5 and 6. I cannot remember. Can't remember the third one. But anyway, we'll do confrontation test. Well, let me do the corneal light reflex too. Okay, now I do see the twinkle, and then I'm going to check for clarity. It does look clear. Looking inside the eye, I would be able to see, to visualize the optic nerve, the vessels, the macula, the fundus. And we're going to do a confrontation test. So I'll get you to cover. That's fine. Okay, so now this is the bunny. So you tell me when you see the bunny.
No.
Okay.
No. No. No.
Okay, and then cover the other eye. And tell me when you see the bunny.
No. 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 No.
Okay, all right. And that was test by confrontation. And now I'm going to move on to the ear. And the auricle is flexible, free moving. Mass joint area is fine. And I would be able to visualize, visualize the eardrum. And it's a pearly gray color. There's a slight bit of earwax in the ear canal, but other than that, it's clear. I don't see any lesions, no obstructions. The cone of light is at 5 o'clock in the right ear. It's at 7 o'clock in the left ear. And I'll do, it's a whisper test, so I'll get you to cover that ear. And now I'm going to whisper something, and you tell me what I said.
The day is gray.
Okay, all right. You got that. Very good. Okay. And then let's do the Weber test. Or actually, that was the Weber test. We'll do the Reinberg. And tell me if you hear it. Both ears equally, one ear more than the other.
Same.
The same? Okay. And now I'm going to place it in behind your ear and tell me when it stops ringing.
No.
You still hear it? Okay, tell me when you hear it stop. And the tests we just did are all for cranial nerve number 8, the acoustic nerve. And next I will look at the nose. And the nose is symmetrical, it's appropriate for his head shape. And both nares are symmetrical. The mucosa is moist. The septum is midline. I see one set of turbinates. And there's no foreign bodies, no exudate, no drainage. And I'll get you to close one nostril. Okay, and then I'll do the other side. Alright, and then keep your eyes closed. And we're going to test the olfactory cranial nerve, number 1. And you tell me what the smell is. Mm-hmm. And occlude one side of your nostril. And tell me what this smell is. Mm-hmm. Sound about right. Okay. Now we'll look at the mouth. The lips are pink. They are dry. They are not chapped. Okay, open your mouth for me. And the teeth are white. They are clean. There is some evidence of a dental work here, where I think a tooth was replaced. And then we'll look at the buccal mucosa. It's pink. It is vascularized. The superior frenulum is in place. The anterior frenulum is in place. Raise your tongue. And the frenulum under the tongue is in place. I would palpate Wharton's ducts. And then there's also upper ducts, Stenson's ducts, I believe. And then let's test the facial cranial nerve, number 7. All right, guess you just show your teeth to me. Okay, puff out your cheeks. Frown. Okay, smile. Raise your eyebrows. Okay, those are good. And then you, I'll get you to swallow for me. Okay, and let's test your, this is the TMJ. And I'll get you to open your jaw and close it. There are no clicks. And move it side to side. Okay, move it against my resistance. Okay. And testing that, jaw strength is cranial nerve number 5, trigeminal. And then we also tested cranial nerve number 9 and number 10, glossopharyngeal and vagus, which are innervated by swallowing, gag reflex. And then the hypoglossal is cranial nerve number 10, which is the tongue movement. And stick your tongue in and out. Okay, and stick it out, way out, open your mouth. Now stick your tongue out. Now say ah.
Ah.
Okay, the uvulae midline. I can't visualize the tonsils. And then we're going to look at the cervical neck, the spinous process. I don't feel any nodules, lumps, bumps. And swallow for me. And the trachea is midline. Okay. And then I would be able to feel where the thyroid gland would be located. Do you feel the notch? Okay, swallow. Okay. And then I would feel for the lymph nodes, the periocular, the ones post-auricular, the ones down into the cervical chain, and then the ones that are deep subclavicular. And none of the lymph nodes should be palpable, of course. And then next I would listen to the temporal artery. I don't hear any bruise on there. And then I would palpate and listen to the carotid artery, and then hold your breath. Okay, and I don't hear any rubs or bruise there. Hold your breath. Okay. Okay, let me get you to take your shirt off for me. And I'll go ahead and pan the camera around the room so you can kind of see where we are. Sorry, I'm kind of shaky here with the camera. Okay. And the camera again. Okay, and next I'm going to assess the lungs. And the chest is symmetrical. Big breath. And out. It's positive for respiratory movements. I don't see any extra movements. Okay, and then I'm going to listen. And then I do a side-to-side pattern, down and across, listen bilaterally. And lungs are clear, no adventitious sounds or swiftness. And I would percuss all the areas. And any condensed area would be a more dull sound. Standing behind him as he takes a deep breath in. Take a deep breath in. Take a deep breath in. And out. Okay, I can see the thoracic expansion. And I would be able to percuss and measure the thoracic, or the diaphragmatic expansion. And that would be from where, when he would take a deep breath in and hold it, I would measure, percuss, measure, and the normal distance is 3 to 5 centimeters on that. Okay, and then let me get you to turn maybe that way. And what I want to do now, I'm listening for tactile fremitus, and I would place my hands going down the back and have the patient say 99.
99. 99. 99. 99.
So, and I did hear equal vibration on both sides. Okay, now I'll get you to lie back for me. And I'm going to assess cardiac. And the point of maximum impulse is going to be right around the left fifth intercostal space. Okay. And I'm going to start second intercostal space on the right side. And that's the aortic area. And then we'll cross over to the second intercostal space, left side. That's the pulmonic area. Third intercostal space down is urge point. Fourth intercostal space down is the tricuspid area. And then the fifth intercostal space is the mitral area. And I would listen to the heartbeat for a full minute. And I don't hear any rubs, murmurs. And then I would assess the arteries, which of course the temporal arteries, the carotid arteries, the brachial arteries, the radial artery, and then the femoral artery, popliteal artery, which is behind the knee, and then the lateral, which is at the ankle, and then the dorsalis pedis, which is at the top of the foot. And I would check those, of course, bilaterally to make sure that they were equal. Next, I'm going to move on to the abdomen. The abdomen is pink in color. It's the same. It's consistent with the color over the rest of the body. He has normal male hair pattern distribution. The abdomen is round. I don't see any bulges, no evidence of any hernias. He does have a few little macules to the abdomen, some scattered striae on each side bilaterally. The umbilicus is midline, it's inverted. There's no exudate, it's clean. And now I'm going to listen in all four quadrants. And I would listen for at least a full 5 seconds in each area. And he does have vowel sounds in all four quadrants. And then I would palpate the abdomen. And then the liver can be assessed in the patient's right area. And to palpate or to percuss the liver, you could either begin from the top or the bottom, and the bottom working your way up till you come across the dull sound, bottom of the liver. Starting down, you would come down until you can palpate the dullness. Then you do measure, and you would come 6 to 10 centimeters is the normal length of the liver. You can actually try to palpate the liver by having the patient cough. I'm not able to feel the liver there. And then the spleen is on the patient's left side. It's tucked up underneath the rib cage, so it wouldn't be palpable. There's, of course, the kidneys bilaterally. Could also have the patient cough, and you may be able to feel those. I think that's about it for the abdomen. And then while the patient's laying down, I would begin the musculoskeletal. And I'll begin that by testing the hips. I'll get you to raise your leg, flexion, and bend it back down, extension. All right, now push up against my hand. Okay, and push down. Okay, good. And now I'll get you to put this ankle on this knee. Okay, and that's external rotation. And then I'll get you to straighten and push the knee up. And then push it inward. That's internal rotation of the hip. We would do external, or we would do hyperextension when he stands up, of course. With the knees, you're going to pull the leg up, pull the knee up towards your chest. Extension. Okay, and then straighten it out. Okay, and we don't ever hyperextend the knees, and the testing would be the same. And we would do this bilaterally. All right, I want you to push your foot towards me. Okay, now pull up. Okay, and I want you to push your foot down, flexion, extension, and back hyperextension. Okay, and then you're going to turn them in. There you go. Internal rotation, and then go outward, external. and then just rotate your ankle. Okay, good. All right. Okay, let me get you to stand up. Okay, and I'll get you to bend this way. And now bend down and touch your toes. And that's going to be extension. And while you're bent over, I would check for any kind of scoliosis with the spine. Okay, and then back up is extension, and then back is hyperextension. Okay, and then I want you to go side to side, and then rotation. Okay, very good. All right, you can sit down for now, and you can put your shirt back on. Okay, now we're going to test the elbow strength. And the elbow is simply and down. Okay, and then back up. Alright, and then push down against me. Okay, and then push up. Okay, good. Alright, and you don't hyperextend the arms, of course, the elbows. Alright, and then now we're going to do the shoulders. Flexion, extension, hyperextension. And then we're going to do external rotation and then internal rotation. Very good. Okay. And now we're going to do with the wrist and the hands up, down, and then all the way back is hyper. Okay. And then rotate the wrist and then lateral and outer. Okay. And then now the fingers. We're going to go up, down, up, hyperextend. Alright, and then abduction, adduction. Okay, and then try to pull your fingers apart. Okay, and then try to pull them in. Okay, and then I want you to squeeze my fingers. Okay, grips are equal bilaterally. Okay, now we'll do the neck, and I'll get you to push forward and then push backward. Okay, and then forward, and then straight, and then hyperextension is back, and then you do lateral to each side, each shoulder, and then rotation. Okay, and then try to push against my hand. Okay, and then we'll also, while I'm here, we'll do shoulder shrug, which is cranial nerve number 11, spinal. So I'll get you to shrug your shoulders. Okay, and then push them back down, and now I'll try to push up against me. There you go. Okay. All right, and I'll get you to stand up. All right, feet together. Close your eyes. Okay, and that's a negative Romberg's. Now I'll get you to walk to that way normally. Gait is normal. And then walk back heel to toe. That is not heel to toe. Heel to toe, please. Okay, very good. All right, now stand facing me. And we're going to do the forefinger to the nose. Do the other one. Just one finger, please. Thank you. Okay. All right, arms down. And then while you're standing up, I'll get you to test. We'll do test your arm strength. All right. Push up against. All right, and push down. Okay. All right, good. And then we'll do the hyperextension of the leg. Okay. All right. Very good. Okay. Now I'll get you to just repeat what I do. We're going to do. Can you see me? Okay. We're going to do fast motion on your legs, on your knees, back and forth. Okay, very good. Okay, now stand up, and I want you to place the heel of one foot down the shin of the other foot. Go from the knee down. There you go. And then you would do the other side as well, bilaterally. Okay, okay, good. All right, sit. Okay, so now we're going to check, we're going to do a few tests to check the joints and do a few soft tests. This is going to be the soft touch arm. You're going to feel soft and sharp, and you tell me where and which you feel, soft or sharp, okay?
Mm-hmm.
And you tell me where you feel it.
Soft arm.
Mm-hmm.
Sharp arm.
Okay.
Soft ankle. Sharp ankle.
Okay, and you would do both of those. Then I'm going to place an object in your hand, and you're to tell me what the object is, without looking, of course.
Paperclip.
Right? And then I'm going to test I'm going to write a number in your palm, and you have to tell me what number it is.
4.
Good. Okay. And then now I'm going to test vibration, and I'm going to put it on a joint, and you tell me when you can feel it vibrating and when it stops vibrating. Feel, not hear.
Feel.
Not really? Alright, let's try it again. Do you feel it, Bill? Let's try it again.
Okay, I feel it.
Feel it, okay. And then
It stops.
you feel when it stops, okay.
Yeah.
Okay. And then it stops, okay. Alright, and then next we're going to do the position test. And I'll check your hands and your fingers and toes. And this is up, this is neutral, and this is down, okay? So hold both hands out for me. Okay.
Up. Neutral. Up. Down.
Okay. All right. Good. And then I would test your reflexes, and you would begin by, I don't have a hammer, so I'm going to use just the light tap of this, and then you would begin with the biceps. Just relax your arm. And you would look for a slight jump. And then the triceps. And then the brachial radial. And then I would test, of course, the patellar, which is on the front of the knee. And then I would actually have him get up on the bed, and I would tap the very back of his ankle to test the ankle jerk reflex. No. Okay. Let's see. I'll ask you a couple questions to test some cognition. If I were to give you an envelope with a stamp, what would you assume that you would need to do with it?
Put something in it and mail it.
Okay, right. And then there's an old saying. I'll get you to tell me what the belief or what the meaning of it is. Take time to smell the roses. What does that mean?
It means to stop, take it easy sometimes.
Right. Okay.
Rest a little.
Very good. Okay. And I think that's it. Thank you.